Good morning, wherever you are. This is Sophia Reyes from ConferenceHype. Our segment will focus on the Pediatric Pulmonary Hypertension International Risk Score, a prediction model for outcomes using machine learning. From the 2026 August 11 edition of Circulation. Background: the Cre/LOX-P recombination system is the main tool for cell type-specific lineage tracing and gene targeting. Methods: to achieve precise manipulation of ASMCs in vivo, we combined alleles for CSPG4-DRI and ROX-stop-containing ACTA2-CRE, generating a mouse line with CRE activity exclusively in ASMCs. Results: intersectional genetic approaches using CSPG4-DRI and ACTA2-ROX-CRE, mouse lines specifically targeted ASMCs within various organs. Discussion: the successful generation of mouse lines specifically targeting different subtypes of SMCs enhances specificity, allowing distinction between vascular and non-vascular effects of diseased SMCs. From the 2026 August 18 edition of Circulation. Background: patients with peripheral artery disease are at high risk of major adverse limb events and major adverse cardiovascular events. Methods: clear outcomes randomized 13,970 patients to bempedoic acid 180 mg or placebo from December 22, 2016 to August 14, 2019. Results: a total of 1624 of the enrolled patients had PAD at baseline. Discussion: patients with PAD are at high risk of males and MACEs. From the 2026 August 18 edition of Circulation. Background: metanol is a secreted protein that plays a pivotal role in regulating insulin sensitivity, angiogenesis, and atherosclerosis. Methods: by using global metanol knockout mice, platelet-specific metanol knockout mice, recombinant metanol protein, and metanol-neutralizing antibody, combined with visualization techniques, we investigated the effects of metanol on human and rodent platelet activation in vitro, and thrombosis in vivo as well as its action mode. Results: metanol deficiency potentiated thrombosis via platelet activation rather than coagulation or the fibrinolysis system. Discussion: we identify metanol in both endogenous secretion and exogenous administration as a novel inhibitor of platelet activation and thrombus formation without causing bleeding risk. From the 2026 August 11 edition of Circulation. Background: internal N7-methylguanosine is a recently identified chemical modification of mammalian mRNA. Methods: we integrated epitranscriptomic profiling, human tissues, genetically modified mice, and targeted nanomedicine approaches to investigate the role of METTL7A, a putative internal M7G methyltransferase, in endothelial mechanobiology and atherosclerosis. Results: atheroprotective unidirectional flow significantly induced METTL7A expression, which promoted internal M7G methylation of endothelial transcripts without affecting cap-associated M7G discussion. METTL7A is a mechanosensitive internal M7G methyltransferase that maintains endothelial homeostasis by stabilizing the anti-inflammatory transcripts KLF4 and NF-kBIA. From the 2026 August 18 edition of Circulation. Background: in select semaglutide effects on heart disease and stroke in patients with overweight or obesity. Among 17,604 patients with known atherosclerotic cardiovascular disease and overweight or obesity, but not diabetes, randomization to the glucagon-like peptide 1 receptor antagonist semaglutide significantly reduced the primary outcome of major adverse cardiovascular events compared with placebo. Methods: in this pre-specified select substudy, we evaluated whether baseline hsCRP levels predicted MACE risk and examined the relationships between changes in hsCRP levels and time to first MACE, baseline body weight, weight loss, and other clinical measures among treatment groups over time using multiple approaches, including Cox modeling. Results: baseline hsCRP level, which was similar in the semaglutide and placebo groups, was prognostic of future MACEs. Discussion in Select HS-CRP data at baseline and in response to treatment with semaglutide support inflammation as a potential prognostic factor associated with cardiovascular risk in these generally well-treated patients with atherosclerotic cardiovascular disease and overweight or obesity, but not diabetes. From the 2026 August 18 edition of Circulation. Background: RA-sopathies constitute a group of rare genetic disorders caused by mutations in genes along the canonical RAS mitogen-activated protein kinase signaling pathway, affecting cell growth and differentiation. Methods: we performed a drug screen of clinically relevant compounds in transgenic Drosophila models of RA-sopathies to identify candidate therapeutics. Results: rigosertib was effective across a panel of transgenic Drosophila RA-sopathy models, suggesting activity against multiple disease variants. Discussion together. Our findings suggest that rigosertib normalizes and reverses RA-sopathy-associated HCM and other NS-associated syndromic features, supporting its development as a promising treatment for RAF1-associated HCM and potentially other RA-sopathy-dependent pathologies. From the 2026 August 18 edition of Circulation. Background: the role of leukocytes in the pathogenesis of right ventricular dysfunction associated with heart failure with preserved ejection fraction remains poorly defined, partially due to the lack of suitable small animal models. Methods: young and aged male and female C57BL6J mice were divided into 4 experimental groups: CHOW, HFpF, chronic hypoxia, and HFpF plus hypoxia. Results: RVHFpF resulted in left ventricular diastolic dysfunction, indicated by increased EE ratio, reduced global longitudinal peak strain, smaller end diastolic diameters, and increased isovolumetric relaxation time compared with CHOW. Discussion: we demonstrate that dysregulated myeloid cell dynamics are associated with, and directly contribute to, the pathogenesis of RVD associated with HFpF in humans and mice. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 August 11 edition of Circulation. Background: mature mammalian cardiomyocytes develop compact sarcomeric structures that inhibit proliferation. Methods: we generated adenovirus and adeno-associated virus vectors expressing YAP5SA and YAP5SA S94A under zone control for LMI070 inducible protein expression. Results: we show that microtubule expression and network density decline with cardiac maturation. Discussion: these findings identify microtubule networks as an essential regulator modulating CM dedifferentiation and sarcomere reorganization, which is critical for CM cytokinesis and cardiac regenerative repair. From the 2026 August 11 edition of Circulation. Background: Chagas disease, a neglected cardiovascular condition, affects 7.5 to 10.5 million people worldwide. Methods: we conducted a prospective study embedded in the telehealth network of Minas Gerais, Brazil, across 107 municipalities in hyperendemic and endemic regions. Results: among 75,779 eligible ECGs, the AECG API model was available for 59,154 individuals. 6812 screened positive. Discussion: in this community-based study, an AECG API model integrated into a public telecardiology network enabled feasible opportunistic screening for CHD in primary care. From the 2026 August 11 edition of Circulation. Background: cardiomyocytes exhibit marked susceptibility to ferroptosis after myocardial infarction, rendering ferroptosis inhibition a promising therapeutic strategy to mitigate ischemic myocardial injury. Methods: to clarify the temporal role of the various modes of cell death in MI progression, we performed time-course echocardiography in MI models treated with various cell death inhibitors. Results: we found that cardiac ferroptosis peaked at day 7 after MI and was enriched in peri-infarct cardiomyocytes. Discussion: this study revealed that ABHD11-mediated mitochondrial DNA transcription attenuated cardiomyocyte ferroptosis after MI by orchestrating a mitochondrial nuclear crosstalk, offering a novel therapeutic strategy for ischemic myocardial injury. From the 2026 August 18 edition of Circulation. Background: clonal hematopoiesis of indeterminate potential has been associated with cardiovascular disease, but its relationship with silent brain lesions and cognitive decline in patients with atrial fibrillation is unclear. Methods: in this prospective, multicenter cohort study, we included 1572 patients with AF enrolled between 2014 and 2017. Results: among 1572 patients with AF, 342 carried CHIP sequence variations, most commonly in DNMT3A and TET2. Discussion: in patients with AF, CHIP was independently associated with a greater burden and progression of silent brain lesions and with accelerated cognitive decline. That's it for now for ConferenceHype's coverage of the August 2026 issue of Circulation. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments, share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.